Peter Knowlton, I'm president of the UE Northeast region. We represent New England up eastern New York State. I've been with the UE for about 30 years negotiating contracts all around health insurance. And probably during that entire period of time, for people who've been doing like I've been doing, there's probably been about 5 years of those 30 where healthcare has not been the single biggest issue at the bargaining table. And for those people who forgot, we used to have what people considered national health insurance, and that was called Blue Cross Blue Shield. First it was Master Health Plus. That was what everybody had. And then we went to an HMO system in the 80s, which was thinking it was going to drive down costs because Master Health Plus was becoming exorbitantly expensive. We had shops in the 1980s who had a family premium of $750, which now seems low. In that time was really high. And then they were able to go over to Pilgrim HMO and drive down the cost to $350, $400. In an effort, that was what the industry's response was to rising costs. We went to HMOs, gatekeeper systems, networks, PPOs started coming around, and now the industry basically has to make us pay first dollar amounts as much as they possibly can onto the backs of our members and ourselves in order to drive their costs down. The part that is the scariest for me now, and I was pretty scared in the 80s about where this thing was going as health insurance, is there is no more gimmicks for the industry. So the only avenue for them to go is to continually take more money out of working people's pockets. It'll be in the form of quote-unquote premiums, and as long as we continue to, ourselves as workers, negotiate how we pay for insurance based on a percentage of premium, you are going to continually could be in trouble each and every year. So one of the things that is part of our presentation that I'm going to be doing and talking about in the workshop is as unions, we need to start looking at ways to shift the conversation at the negotiating table about how workers pay for health insurance. The way we've been paying it has been the system for about probably 5-6 decades. So it's a difficult conversation to have, but it needs to be based on income as opposed to premium. Premium, as we all know, is a figure that is created by the industry that only they know how it gets computed. And as long as we continually be in that trap, number one, we're going to be facing with the excise tax in a big way in 2018. And number two, the people on the other side of the table aren't going to get what we're talking about. The biggest disconnect at the bargaining table now is around health insurance. Aside from pensions, it's health insurance. And the reason is because the people on the other side of the table, and I'm really glad Ms. Mitchell is here, because if you were surprised about the criticism about Obamacare, we actually call it Obamacare. I'm from Massachusetts, so I can't call it Obamacare. I have to call it Obamacare. Is because you haven't been coming to forums like this, and I really encourage you to do more. We have a lot of members who are now looking at GIC for the first time. They've been avoiding it for years, but now are being forced to look at it because the setup that they have, for instance, the Old Rochester Regional School System, is horrible. But when we get to the table, the biggest disconnect is the suits on the other side of the table. And I mean that with all due deference and respect for a suit. But they're making 6 to 7 figures on the other side of the table. And when you pay percentage of premium, they have no idea what our members are going through in terms of cost. I live in Dartmouth. I represent the Old Rochester Regional School System in the food service and custodial workers. During the last negotiations for the custodial and food service workers, the school board proposed, because the towns forced the school board to propose, that we pay 50% of the premium. Now, a dirty little secret in the state of Massachusetts is that it's not unusual for municipal workers to pay 50% of the premium. It's been that way for decades. But 50% of the premium, when it was $300 for the family plan, was not such a big chunk of change. When the average premium is around $2,000 to $2,400 a month for even just a Chevy plan, we're talking to talk real change. So the result of that was, at the end of that year, if we had agreed to it, our cafeteria workers would have owed the school district money at the end of the year. And basically would have gotten no wages, obviously. We would have been back to 1863 prior to the Emancipation Proclamation. So that's a real concern of ours. Thank you, Rand. That's a real concern of ours. Just finally, the biggest disconnect right now is the business community, and has been and continues to be. It is that community. I don't necessarily disagree with the brother from Siegel said, but they were thinking about our community. They just weren't thinking about our sector of the community. They were thinking about the business end of our community. because I know that, because I went and met with John McDonough, one of the directors of Healthcare for All, and the architects of the plan here in Massachusetts. It was evolved there. I went there before the ACA started to get debated on purpose, because I knew that he had been one of the architects of the plan here. So we sat and we talked, and I asked him about the public option. And he said, it's not going to happen. He said, the legislation I'm going to introduce, how do you know it's not going to happen? It's just not going to happen. Business community's not going to allow it. And he was correct. Despite the pressure that we tried to put on the administration to get the public option, which was the only saving grace out of that legislation that would have helped those of us who already had insurance. We should be clear about that. Those of us who had insurance, that would have given us an ability to maybe get some saving grace. But it didn't happen. I wasn't surprised. It continually is the biggest problem for us. How do we put enough pressure on the business community to get them to come to their senses and off their ideological train wreck? That's the biggest problem we have right now. And it's all ideology. It has nothing to do with pragmatism. So that is my biggest pitch continually. So our whole strategy is how do we develop that at the bargaining table, putting enough pressure on the employer to get them on our side.